Thank you very much. When Robin called me about this, I was so excited because I've spent my whole career in the healthcare industry, in the medical technology world, primarily launching many new medical technologies. But I also am a child of an Air Force pilot, and I grew up outside of this country and traveling extensively. And I'm just disgusted with the state of our healthcare industry. And I've been in it for a long time. It's totally broken. It's a sick model. We think we're a real cool country, but we have the most expense per capita of anybody in the world for healthcare, and we have the worst statistics. The statistics are really, really bad. Everything from birth weights to death rates, etc. So I believe that, and I love my industry, but it's time to change it significantly. And I had the opportunity, actually, for my last company to launch a company called CardioNet, which was the first application of wireless technology for 24/7 arrhythmia management. And it revolutionized the ability to diagnose those patients. And it was such a struggle to get that company launched because of the regulatory reimbursement environment in this country. It was just disgusting. And we had the ability to change people's lives, but 11 years later, we finally were able to go public and really, blow the company out. And one of the things that I noticed in that company versus other medical technologies is that one of our partners was Qualcomm. And I believe that change in healthcare is not going to come from the healthcare industry. Yep. The reason that technology worked, it wasn't about cardiac arrhythmia monitoring. We've done that for years in hospitals. It was because of the wireless revolution. And it's going to be the Verizons and the AT&Ts and the Intels and the Googles and the Microsofts that are going to have to come. The entertainment industry, what's happening in gaming technology. People spend more time having fun and they get addicted to wonderful games and entertainment. They don't get addicted to anything good in healthcare. Yeah. Nothing good. The only thing we're addicted to in this country is bad food that we have populated the world with. So one of the things Robin said is, what would you recommend to whoever the new leader is in this country? And I said, I think that the one thing we have to do is really give consumer empowerment. Look to the consumer, and the companies that embrace the consumer and actually are able to get into their minds and get consumers to do things in a positive way. I also think that, it's time to create a healthy America. We are we have really created cardiac disease throughout the entire world with our bad food system. So if we're going to have change in healthcare, you're going to have to take the food industry and figure out some issues about how people are eating. We're going to have to identify and reward cities and places where they create healthier people. I was just at the AdvaMed Medical Technology Conference, and Colorado Springs had a booth there, and one of their goals is to become the #1 healthy city in the United States through hiking and biking and trails. And do you have to get all dressed up and commute to go to work every day, or can we have the ability to have people exercise and ride a bike to work and make it easy for them to do that? So I think it's really about totally turning the industry upside down and saying we need to think totally differently about what we have, and look to other countries as well, because we don't necessarily have the model here like we thought we always had. And I think this blog is just phenomenal. I think that women are the leaders in purchasing healthcare, decisions in healthcare, and they have made a difference in the breast cancer movement, and I think we all need to get on top of this bandwagon and make sure we have a healthy place for ourselves, our parents, and our children. And thank you, Robin, for doing this.
Thank you very, very much. Thank you.